Good day, everyone. Today here we have here Mommy Joyce and Daddy Nat, and of course their son Uno. Hello, Mommy and Daddy. How are you today? And can you give us a background story of your son's condition?
Yun
Go
po.
ahead, Daddy.
Ako na.
Daddy or Mommy? Yeah, yeah, yeah.
Ayun po, so good morning po, Ma'am Marisa. So this is Uno po, our only child. He's 5-year-old. Just to give a quick summary po of what happened. Ultimately, siguro po, yung weeks prior to September 22nd, the night na we rushed him to ER, we
Mm-mm.
noticed some symptoms like yung difficulty walking, naging less active po siya. And then yung naging decision making namin as to why we wanted to rush him to the ER is yung difficulty in breathing.
Mm-hmm.
So um, we first went to LaSalle Hospital sana because na din po yung pedia, pero hindi po kami tinanggap given that since difficulty in breathing, he'll be treated as a COVID patient. Hindi kasama po siya sa mga COVID positive na patients. And unfortunately, even that night, wala din pong available na room. And when we called around, wala pong hospital na nag-accept sa amin. So we landed at Asian Hospital.
Mm-hmm.
Tapos, ayun po, when we arrived to Asian Hospital, at first, sobrang lakas niya pa, kumakain and all, hanggang sa after a few hours po ng stay namin sa ER, nag-vomit siya, and then doon na po nag-deteriorate yung health niya. So, um, yung tumaas po ng sobra yung heart rate niya, at doon na po siya, uh, tawag dito, binigyan ng na tawag doon, cardioversion, which is yung para pong
Mm-mm.
pinoriente siya to control yung heartbeat niya. And then from there, from the ER, he was initially diagnosed with myocarditis because of yung severe inflammation ng heart niya.
Mm-hmm.
And then that night, we were told na he only had 30% chance of surviving given yung overall condition niya. And also that night, he was placed in ICU, and then we stayed there for all 45 days before
45
po
days.
kami nadala sa regular room. So during his ICU stay, dun din po na discover na meron siyang pneumonia. And then eventually na MRI siya, na diagnose din po na meron siyang thrombosis, or kumbaga stroke. Yung brainstem niya po yung severely affected. Nagkaroon po ng clot sa artery niya, which explained yung mga gait problems niya, like yung difficulty in walking, yung drowsiness po pala, yung napansin din namin prior to hospitalization. Ayun. So he underwent major procedure. Nagkaroon po siya ng ilang operation, like yung central line. Ito nga po, intubation. Nag-cardiac arrest din po pala siya sa ICU. Nag-flatline siya ng mga almost 5 minutes. So thank God he was survived. And then ayun din po, tube feeding na lang din. So thank God kasi po after all the major treatments, mga high dosage medications and steroids, um, nung last, what do you call this, nung last 2D echo niya po, the doctors very happy to announce na maganda na po yung ano niya, yung heart niya, almost back to normal. Pero need pa rin po ng regular medication and maintenance up to 6 months. Tapos nawala na rin po yung pneumonia niya. Nawala na rin po yung blood clot niya sa brain. Pero based po doon sa huling CT scan niya, maga pa rin po yung brainstem niya. That explain yung inability niya to recognize what he sees. He's unable to speak and eat. Hindi niya pa po nagagalaw masyado yung mga extremities niya like yung arms and yung legs. So, bedridden po siya at the moment. So, continuous po yung medication sa bahay and we were advised na the physical therapy and occupational therapy and eventually speech therapy have to be on a regular schedule para magtuloy-tuloy po yung recovery niya. So right now po, parang we are treating him as a stroke patient while minomonitor po namin yung vitals niya to ensure na yung heart niya remains okay and yung ability niya to breathe on his own remains okay as well. Sorry hindi ko po nabanggit na eventually doon sa ICU because of the results, blood results and physical observation and yung ilang mga symptoms niya, nag-change po yung diagnosis pala from myocarditis to MESI, which is also known as multisystem inflammatory syndrome in children, which for the doctor is a post-COVID infection. Pero the doctors po all agreed na yung hindi po regular na MESI yung case ni Una kasi they're puzzled kasi sabi nila on a regular patient usually it's either heart lang yung affected or yung brain but kay Uno po is multiple system multiple organs talaga. And it's very rare na po talaga. Actually ngayon lang sila naka-encounter ng MESI patient na may na both heart and brain are affected. So yun po yung naging basis nila why they consider Uno's case as rare.
Okay. So moving forward, what is the next course of actions for his condition? What are the treatments na he should undergo pa?
Ayun po, continuous medication sa heart po tsaka sa brain niya para po mag-subside yung swelling at unti-unti siyang makarecover. Pero very important din po na regular yung physical therapy, yung occupational therapy, and speech therapy niya po para mag-go back siya to normal. Tapos yun po yung strict adherence to prescribed home care, yung suctioning, tube feeding, ayan. Tsaka po yung usual care, paligo, vitamins, ganyan.
All right. Okay. Now, next question is I would like to ask regarding the finances. So, for the hospitalization, and then also for Uno's upcoming treatments, did the doctor like give you an idea of how much you should be prepared?
Wala pong estimate na binigay sa amin, pero siguro po when we did our initial computation, aabot po yung monthly expense niya to around 100,000 inclusive na po dun yung medical supplies, yung gamot, yung vitamins, yung hindi po kasi ni-require po kasi yung caregiver, so hindi po kami pinauwi ng walang caregiver. Tapos yung session niya nga po with PT and OT. Saka po yung mga follow-up check-ups and laboratory tests.
All right. Okay. So approximately, more or less around 100,000 per month, no, for all the medications, the therapies, maybe the laboratories or the doctor's checkups and everything.
Yes po, po.
So which is quite heavy, right? Okay. Okay. How about Mommy, Daddy? Can you give us just a bit background of your family, just so we get to know more you better?
Opo. So ano po bang
like your family dynamic po, does Uno has siblings? And about Daddy, Mommy, how about your parang what do you do for a living? Just so we get to more understand your situation better.
Okay po. So kami po ni wife, we've been married ilang years na nga tayo. kasalan.
Mag-10. Magta-10 next
10
month.
years, but
Mhm.
22 years in the relationship. We were together since high school, and then si Uno po is our only child. And just to share po, my wife has a poor OB history. So before po na nagkaroon kami ng Uno, my wife had multiple miscarriages.
Mhm.
And thank God, after so many prayers din po, my wife is pregnant. Right now, she's 4 months into her pregnancy.
Mm.
Ayun po. Tapos, we live in Dasmariñas, Cavite. I work po as a training manager in a call center company in Quezon City. And then my wife is working as a assistant product manager in BDO po. Um, what else? Um,
That's okay, actually. We just want to get to know you a little bit better. All right.
mm,
So far we have understood, and it's actually quite a difficult thing, and it was also quite scary experience, no, when
po.
Uno went to ICU and everything.
Mm,
Yeah. So, and kudos for you both for staying strong. Okay, mommy, daddy,
thank you
can you
po.
give us just a short, message for our givers so that they can a little message lang to them asking for what do you want to tell them, and especially to encourage them to also help you out. Any mommy or daddy.
So, Nani? Oh, ayun
Ikaw
po.
na.
To all givers and donors po, we sincerely and wholeheartedly knock on your kind hearts to help our only child, Uno, get the prescribed medication for his continuous recovery. We guarantee you that you are helping a brave and courageous 5-year-old fighter.
Mhm.
He at a very young age he underwent major medical procedures, and he survived all fatal medical condition, like he had stroke, he had pneumonia, and he had two cardiac arrest. But this brave little boy has been showing big heart to fight the messy virus. So with all your help, we can guarantee this boy support, and give him the best treatment possible so that he recovers fast from his current condition. Any amount po na you can share with our son will be highly appreciated. And we promise to pay it forward. And we will continue to pray that and we know that God secretly will pay you in return for your kind deeds. So thank you po.
All right. Thank you so much, mommy and daddy, for your time and for sharing us your story. We hope and do that we will do all our best to help Uno. Okay, so we wish you all the best. Take care. Take care,
Thank you
Uno.
po.
Thank you so
Yeah, you
much
Thank you,
get
po.
well
Mama
soon.
Rita.
Thank you for your time.
Thank you po.
Thank you. Bye-bye.
Bye-bye.